For 22 years, I cleaned the offices where City Memorial Hospital's biggest secrets were discussed. As head of night cleaning services, I had access to boardrooms, executive offices, and confidential documents that revealed how healthcare executives really operate behind closed doors. But when the new hospital director, Dr. Amanda Richardson, looked me in the eye and called me just a cleaning lady who should focus on mopping floors, she made the biggest mistake of her career. What happened next exposed a $50 million fraud scheme, ended multiple medical careers, and revealed how hospital administrators were literally profiting from patient deaths. From midnight conversations in executive suites to FBI raids that made national headlines, this is how a lowly cleaning lady brought down one of the most corrupt healthcare operations in the state. Stay until the end. You'll see how the people everyone ignores often hold the keys to bringing down entire criminal organizations, and why underestimating a woman with 22 years of documentation can be a career-ending mistake. My name is Maria Santos, and this is how I used decades of carefully preserved evidence to send Dr. Amanda Richardson and her accomplices to federal prison for healthcare fraud, insurance manipulation, and conspiracy charges that shocked the medical community. The new director's arrival. Dr. Amanda Richardson arrived at City Memorial Hospital in March 2023 with impeccable credentials and ruthless ambition. Harvard Medical School, MBA from Wharton, former healthcare consultant for Fortune 500 companies, and political connections that had helped her secure the director position despite having no actual hospital management experience. At 38 years old, Dr. Richardson was the youngest hospital director in our facility's 90-year history. She was also the most arrogant person I had encountered in over 2 decades of working in healthcare administration. From her first week, Dr. Richardson made it clear that she considered support staff completely beneath her notice. She implemented new efficiency protocols that reduced cleaning schedules, eliminated non-essential maintenance, and cut benefits for hourly employees while increasing executive salaries and bonuses. I had been working night shifts at City Memorial since 2001, starting as a part-time janitor while raising 3 children as a single mother. Over the years, I had earned promotions and eventually became head of night cleaning services, supervising a team of 15 employees who maintain the hospital's administrative offices, executive suites, and confidential document storage areas. My security clearance allowed me access to areas where sensitive conversations occurred and confidential documents were stored. More importantly, my night schedule meant that I was present when executives thought no one was listening to their private discussions about hospital operations, patient care decisions, and financial strategies. The insurance manipulation discovery. The first sign that Dr. Richardson was operating illegally came during my 3rd week of cleaning her executive suite. It was 2:47 a.m. on a Tuesday night in April 2023, when I was emptying wastebaskets in her office when I discovered documents that should never have been thrown away casually. The papers were draft contracts with insurance companies that contained handwritten notes about patient classification adjustments and diagnosis code optimization. As someone who had cleaned medical offices for over 20 years, I knew enough about healthcare billing to recognize that the documents described systematic insurance fraud. But what really caught my attention were Dr. Richardson's handwritten comments in the margins. Priority patients equal maximum billing, transfer uninsured to county facility, and most disturbing, DMR recommendations for high-cost cases. I photographed the documents with my phone and continued my cleaning duties, but I couldn't stop thinking about what I had found. Dr. Richardson wasn't just manipulating insurance billing, she was making life and death decisions based on patients' ability to pay. The midnight board meetings. 2 weeks later, I discovered that Dr. Richardson was holding secret board meetings at midnight in the hospital's executive conference room. These weren't official hospital board meetings. They involved private investors, insurance company representatives, and pharmaceutical executives who had financial interests in hospital operations. My cleaning schedule required me to service the conference room after these meetings, which meant I often arrived while conversations were still ongoing. The participants assumed that a cleaning lady didn't understand their discussions about profit optimization, cost containment strategies, and liability management. They were wrong. During one of these midnight board meetings in May 2023, I overheard Dr. Richardson presenting financial projections that made my blood run cold. By adjusting patient classifications and optimizing treatment protocols, we can increase quarterly profits by 30% while reducing long-term costs through strategic outcome management. Insurance executive Robert Chen asked, "Amanda, when you say strategic outcome management, are you referring to the protocols we discussed regarding terminal patients?" Robert, let's just say that some patients represent ongoing financial liabilities that need to be managed efficiently. Our new protocols ensure that resources are allocated to cases with the highest probability of positive outcomes. I realized that Dr. Richardson was describing a system where patients were being denied life-saving treatments based on cost considerations rather than medical necessity. The patient death manipulation. As I continued documenting Dr. Richardson's activities, I discovered something even more horrifying. She was manipulating patient records to increase insurance payments while simultaneously allowing patients to die to reduce long-term costs care. The scheme worked like this. Patients with expensive chronic conditions would have their diagnoses upgraded to more serious classifications that justified higher insurance reimbursements. But instead of providing the intensive care that these upgraded diagnoses required, the hospital would provide minimal treatment and allow patients to die naturally. I found evidence of this manipulation in dozens of patient files that had been carelessly left in Dr. Richardson's office. Medical records showed patients who had been classified as having terminal conditions, but whose actual test results indicated treatable illnesses. The pharmaceutical kickback scheme. My documentation efforts revealed another layer of Dr. Richardson's criminal operation. She was receiving massive kickbacks from pharmaceutical companies in exchange for prescribing expensive medications to patients who didn't need them or could have been treated with cheaper alternatives. I discovered this scheme while cleaning Dr. Richardson's personal office, where she kept financial records that should have been stored in secure hospital accounting systems. Bank statements showed monthly deposits from pharmaceutical companies that totaled over $200,000. Money that was supposed to be research grants, but was actually personal payments. The kickback system was sophisticated, but ultimately documented in Dr. Richardson's own files. Pharmaceutical sales representatives would visit the hospital monthly, review patient records, and recommend specific expensive medications for patients with particular conditions. Dr. Richardson would then pressure attending physicians to prescribe these medications regardless of medical necessity. Patients with mild depression were prescribed the most expensive antidepressants available instead of proven generic medications. Cancer patients were given experimental drugs that cost thousands of dollars per dose when standard treatments would have been more effective. Elderly patients with common conditions were prescribed multiple expensive medications that often caused dangerous interactions. The human cost was devastating, but the financial rewards for Dr. Richardson were enormous. My documentation showed she had received over $2 million in pharmaceutical kickbacks during her first 8 months as hospital director. The confrontation and threat. Everything changed on September 12, 2023, when Dr. Richardson discovered that someone had been accessing confidential documents in her office. Security cameras had captured me photographing papers during my cleaning duties, and she confronted me the next morning as I was leaving after my night shift. "Maria Santos, I know you've been snooping through my personal files," Dr. Richardson said as she cornered me in the hospital parking lot. "What exactly do you think you're doing?" Dr. Richardson, I'm just doing my job cleaning offices. If I accidentally saw documents while emptying trash cans... Don't lie to me, Maria. Security footage shows you photographing confidential materials. You're just a cleaning lady who doesn't understand business operations, but you're interfering with hospital management in ways that could get you arrested for industrial espionage. Dr. Richardson stepped closer, her voice becoming threatening. Here's what's going to happen. You're going to delete whatever photos you took, stop snooping through office files, and focus on mopping floors like you're paid to do. If I hear about you discussing hospital business with anyone, employees, patients, or outsiders, you'll be fired immediately and prosecuted for theft of proprietary information. But Dr. Richardson wasn't finished intimidating me. And Maria, remember that your son, Miguel, works in our pharmacy department, and your daughter, Carmen, is a nursing student who needs our recommendation letters for employment. It would be unfortunate if your family's careers were damaged because you couldn't stay in your lane. The threat against my children was the moment Dr. Richardson sealed her fate. I had been documenting her crimes to protect patients, but now I was fighting to protect my family. The whistleblower decision. That night, I went home to my small apartment and reviewed everything I had documented over 6 months of investigation. Financial records showing pharmaceutical kickbacks, patient files revealing insurance fraud and treatment manipulation, audio recordings of midnight meetings discussing strategic outcome management, photographic evidence of documents describing systematic healthcare fraud. I had enough evidence to destroy Dr. Richardson's career and expose the criminal operation she had built at City Memorial Hospital. But I also knew that challenging someone with her political connections and resources would be dangerous for my family and me. My daughter Carmen, who was in her final year of nursing school, tried to talk me out of coming forward. Mom, what if Dr. Richardson ruins our careers? What if we can't find jobs in healthcare? Maybe we should just stay quiet and hope someone else exposes what's happening. But my son, Miguel, who worked in the hospital pharmacy and had witnessed Dr. Richardson's prescription manipulation firsthand, supported my decision. Mom, patients are dying because of what she's doing. If we don't speak up, we're just as responsible as she is. I spent 3 sleepless nights weighing the risks before making my decision. I called the FBI's healthcare fraud hotline on September 15, 2023, and reported everything I had discovered about Dr. Richardson's criminal operation. The FBI investigation begins. FBI Special Agent Jennifer Walsh met with me at a coffee shop 20 miles from the hospital to review my evidence and determine whether a formal investigation was warranted. Agent Walsh specialized in healthcare fraud cases and had prosecuted dozens of corrupt medical administrators over her 15-year career. Mrs. Santos, what you're describing represents multiple federal crimes, including healthcare fraud, insurance manipulation, conspiracy, and potentially criminally negligent homicide. But I need to warn you that investigating someone with Dr. Richardson's connections and resources will be dangerous. She'll try to destroy your credibility, threaten your family, and use every resource available to discredit your testimony. Agent Walsh, I've been watching patients die while Dr. Richardson gets rich from their deaths. If someone wants to threaten a cleaning lady for protecting patients, let them try. The FBI launched Operation Clean Sweep 3 days later, with undercover agents infiltrating City Memorial Hospital as temporary employees while building cases against Dr. Richardson and her co-conspirators. The pharmaceutical company raids.
The first major breakthrough in the investigation came when FBI agents raided the offices of 3 pharmaceutical companies that had been paying kickbacks to Dr. Richardson. Federal search warrants allowed investigators to seize financial records, email communications, and sales reports that documented the scope of the kickback scheme. What they found was staggering. Dr. Richardson had been receiving payments from 17 different pharmaceutical companies in exchange for prescribing their products to hospital patients. The total value of kickbacks over 8 months exceeded $3 million, making her one of the highest-paid corrupt medical administrators in FBI history. But the pharmaceutical company records also revealed something even more damaging. Dr. Richardson had been sharing confidential patient information with drug company sales representatives, allowing them to target specific patients with expensive medications regardless of medical necessity. This information sharing violated multiple federal privacy laws and constituted a separate criminal conspiracy that could result in additional charges and prison time.
The insurance company cooperation. As the FBI investigation expanded, federal agents approached insurance companies that had been defrauded by Dr. Richardson's billing manipulation scheme. Instead of trying to cover up their losses, insurance executives decided to cooperate with investigators in hopes of recovering stolen funds and avoiding criminal liability themselves. Insurance company records revealed that Dr. Richardson's fraudulent billing had cost them over $15 million in unjustified payments for treatments that were never provided or were medically unnecessary. But the insurance companies had also discovered something that made federal prosecutors even more interested in the case. Dr. Richardson hadn't just been stealing money. She had been systematically killing patients to increase profits while billing insurance companies for intensive care that was never provided. This combination of fraud and patient harm elevated the case to the level of organized healthcare crime that could result in life sentences for everyone involved. The hospital board corruption. Federal investigators soon discovered that Dr. Richardson's criminal operation couldn't have functioned without cooperation from other hospital executives and board members. Bank records and email communications revealed that she had been sharing kickback payments with administrators who helped cover up her activities. Hospital Board Chairman Robert Martinez had received over $500,000 in consulting payments from pharmaceutical companies in exchange for approving Dr. Richardson's prescription protocols and preventing board oversight of her activities. Chief Financial Officer Lisa Chen had manipulated accounting records to hide the source of kickback payments and had created false documentation to justify Dr. Richardson's inflated salary and bonuses. Medical Director Dr. Patricia Williams had signed off on treatment protocols that prioritized profitable patients while denying care to patients who couldn't generate sufficient revenue. What had initially appeared to be one corrupt administrator turned out to be an entire criminal organization that had taken control of City Memorial Hospital and was using it to commit systematic healthcare fraud. The patient family testimonies. As news of the FBI investigation leaked to local media, families of patients who had died under Dr. Richardson's care began coming forward with their own evidence of medical malpractice and suspicious treatment decisions. Dorothy Williams' daughter provided documentation showing that her mother had been responding well to heart treatment until Dr. Richardson suddenly changed her classification to terminal and discontinued life-saving medications. James Rodriguez's son had recorded conversations with hospital staff who admitted that his father's cancer treatment had been stopped for financial reasons rather than medical necessity. Angela Thompson's family had been told that dialysis was being discontinued because it was prolonging suffering, but medical records showed that she had been improving and could have lived for years with proper treatment. Each family's testimony revealed the same pattern. Patients had been reclassified as terminal cases to justify ending expensive treatments, while insurance companies were billed for intensive care that was never provided. The undercover evidence.
FBI undercover agents who had been working inside City Memorial Hospital for 3 months provided the final pieces of evidence needed to bring criminal charges. Agent Michael Brown, posing as a pharmaceutical sales representative, had recorded conversations with Dr. Richardson discussing specific patients who could be targeted for expensive medication prescriptions. Agent Sarah Davis, working as a temporary administrative assistant, had documented midnight board meetings where Dr. Richardson and her co-conspirators planned strategies for maximizing profits while minimizing actual patient care. Most damaging was Agent Patricia Wilson, who had been working as a night shift supervisor and had witnessed Dr. Richardson personally reviewing patient files to identify cases where treatment could be discontinued to reduce costs. The undercover evidence provided prosecutors with dozens of hours of recorded conversations, hundreds of photographs of confidential documents, and testimony from federal agents who had witnessed Dr. Richardson's criminal activities. The dawn raids and arrests. On November 8, 2023, at exactly 6 a.m., FBI agents simultaneously raided Dr. Richardson's home, City Memorial Hospital, and the offices of 3 pharmaceutical companies involved in the kickback scheme. Federal prosecutors had obtained warrants to seize financial records, computer systems, patient files, and any other evidence related to the healthcare fraud conspiracy. Dr. Richardson was arrested at her Beverly Hills mansion while trying to shred financial documents that detailed her kickback payments and offshore banking arrangements. She had been preparing to flee the country using false identification documents that investigators found hidden in her home safe. Hospital Board Chairman Robert Martinez was arrested at his office while attempting to delete email communications with pharmaceutical company executives. Chief Financial Officer Lisa Chen was arrested at Los Angeles International Airport while boarding a flight to Switzerland, carrying $2 million in cash and fake passport documents. The arrests made front-page headlines in newspapers across California. Hospital director arrested for $50 million healthcare fraud scheme. And FBI breaks up criminal organization that killed patients for profit.
The federal indictments. 3 weeks after the arrests, federal prosecutors filed indictments against Dr. Richardson and 8 co-conspirators on charges that included healthcare fraud, insurance manipulation, conspiracy to commit murder, money laundering, tax evasion, and violation of federal privacy laws. The indictments detailed how Dr. Richardson's criminal organization had stolen over $50 million from insurance companies while systematically killing patients to reduce treatment costs. Federal prosecutors called it one of the most callous and profitable healthcare fraud schemes in American history. Dr. Richardson was charged with 47 counts of healthcare fraud, 23 counts of conspiracy to commit murder, and 16 counts of money laundering. If convicted on all charges, she faced life in federal prison without possibility of parole. The media explosion. When news broke that a hospital cleaning lady had exposed a $50 million fraud scheme that involved killing patients for profit, media coverage was immediate and intense. Every major news network wanted to interview me about how I had discovered the crimes and why I had risked my career and family's safety to expose them. Maria Santos proves that heroes come from unexpected places, CNN legal analyst Patricia Davis said during primetime coverage. She didn't have medical training or legal expertise, but she had integrity and the courage to document evidence of systematic patient murder for profit. But Dr. Richardson's defense attorneys tried to use media coverage to discredit my testimony and portray me as an unreliable witness whose evidence couldn't be trusted. Mrs. Santos is a disgruntled employee who misunderstood complex medical and business operations, defense attorney Robert Kim told reporters. She's a cleaning lady without medical training who jumped to conclusions about documents and conversations she wasn't qualified to interpret. The defense strategy backfired spectacularly when federal prosecutors revealed that my documentation had been corroborated by undercover FBI agents, pharmaceutical company records, insurance company evidence, and testimony from other hospital employees. The trial and testimony.
Dr. Richardson's trial began 8 months later and lasted 4 weeks. I testified for 2 full days, presenting evidence I had gathered during 6 months of documentation and explaining how her criminal schemes had functioned within the hospital's operations. Federal prosecutors used my photographs, audio recordings, and detailed logs to build a comprehensive case that Dr. Richardson had systematically defrauded insurance companies while killing patients to increase profits. My testimony was supported by FBI agents, pharmaceutical executives, insurance investigators, and families of patients who had been murdered. The most powerful moment came when I testified about my confrontation with Dr. Richardson and her threats against my family. She called me just a cleaning lady and threatened my children's careers because I had discovered evidence that she was killing patients for money. But someone had to speak up for the patients who couldn't protect themselves. Defense attorneys spent hours trying to discredit my testimony by emphasizing my lack of medical training and suggesting that I had misinterpreted complex business documents. But federal prosecutors pointed out that my evidence had been verified by medical experts, FBI investigators, and financial analysts who all confirmed that Dr. Richardson had been committing systematic healthcare fraud. The verdict and sentencing. The jury deliberated for 6 hours before returning guilty verdicts on all charges against Dr. Richardson and her co-conspirators. Jurors later told reporters that my documentation had been the foundation for their decision, and that Dr. Richardson's threats against my family had convinced them of her criminal intent. Dr. Amanda Richardson was sentenced to life in federal prison without possibility of parole, plus 30 years on related charges. She was also ordered to pay $75 million in restitution to insurance companies, patient families, and the hospital system. Hospital Board Chairman Robert Martinez received 25 years in federal prison. Chief Financial Officer Lisa Chen received 18 years. Medical Director Dr. Patricia Williams received 15 years and permanent revocation of her medical license. During sentencing, federal judge Maria Gonzalez addressed Dr. Richardson directly. "You took an oath to protect patients, but instead you killed them for profit while stealing millions of dollars from the healthcare system. Your crimes represent the worst possible abuse of medical authority and public trust." The hospital transformation. City Memorial Hospital underwent complete reorganization under federal oversight, with new administrators, enhanced patient safety protocols, and independent monitoring of all treatment decisions and financial operations. The facility was renamed Community Health Center to distance it from the criminal organization that had controlled it under Dr. Richardson's leadership. My family and I received death threats from Dr. Richardson's supporters, but we also received support from patient advocacy groups, healthcare reform organizations, and thousands of people who recognized that someone needed to speak up for patients who couldn't protect themselves. The California State Legislature passed new laws requiring independent oversight of hospital treatment decisions and mandating whistleblower protections for healthcare employees who report potential patient abuse or financial fraud.
The recognition and continuing impact. I received the Citizen Hero Award from the FBI for my role in exposing healthcare fraud and protecting patient safety. The award ceremony was attended by families whose loved ones had been saved by the investigation my documentation had triggered. Maria Santos represents the best of American values, FBI Director Jennifer Martinez said during the ceremony. She risked everything to protect people she had never met, and her courage saved countless lives while bringing criminals to justice. But the recognition that meant the most came from current hospital employees who told me that patient care had improved dramatically since Dr. Richardson's criminal organization had been eliminated. Today, I continue working in hospital maintenance while also serving as a patient advocate and training healthcare employees on recognizing and reporting potential fraud or abuse. My story is taught in healthcare administration programs as an example of how institutional crime can be exposed by employees who have access to confidential information.
Dr. Richardson is serving her sentence at Federal Medical Center, Carswell, and will never be eligible for release. Her case has become a landmark prosecution that established new federal guidelines for investigating healthcare fraud and protecting patients from medical professionals who prioritize profits over human life. The lasting message? The Amanda Richardson case taught everyone involved that patient safety depends on the vigilance of all hospital employees, not just doctors and administrators. The people who clean offices, maintain equipment, and handle confidential documents often see evidence of crimes that others miss or choose to ignore. Dr. Richardson made the fatal mistake of believing that job titles determined the value of someone's observations and moral courage. She learned too late that dismissing a cleaning lady can be the most expensive error of your career, especially when that cleaning lady has been documenting your crimes for months and has the integrity to risk everything to protect patients. My story proves that ordinary people can expose extraordinary crimes when they have the courage to speak truth to power, regardless of personal consequences. Healthcare fraud thrives in darkness, but it can't survive exposure by someone who refuses to be silenced or intimidated. And sometimes, the person everyone underestimates is the one who brings down entire criminal organizations.